Hi, it's Dr. Steve Weiner, and what I'm going to show you today is a Bellafill injection for acne scarring. This patient has been treated with Bellafill once before, and it's a series of 1, 2, 3 treatments, usually 2 or 3. And what Bellafill is great for, it's those rolling scars, those scars that look like saucers, that flatten out when you stretch the skin. It's not as good for the boxcar scars or the ice pick scars. And for that we use Infini. So we often combine the 2 treatments, Bellafill first, Infini the same day, just after. She sat here with topical lidocaine with tetracaine on her skin, and we do that when we do the Infini. When we don't do the Infini, we just numb the skin with this device, which is called RTEC, which is a cooling device. So I'm going to be an acne scar site for Bellafill in the near future, and they're going to have these centers across the country. So what I like to do with Bellafill to get these acne scars is, because they're very difficult to see, I'd like to turn off the lights and use this special light from Syris, which has a filter in it, which enables me to see the acne scar depths very well. So we'll turn those off, and so what I use is cross lighting, and I'm treating the scars here by injecting a very little amount, and then we just take a look and see the results. But she's already told me she after her first treatment that she was extremely pleased with the procedure. And so you have to turn the skin in a lot of different directions to see the acne scars best. And you get it in the superficial dermis, and you do a little bit of subcision and then a little injection and a little bit of massage. And then you move on and you treat all the different scars. Occasionally there'll be a little bit of bruising and swelling afterwards. And so if I can see this scar right here a lot better from above, and so I'm going to treat that. And it's good to get it in a couple different directions. And give me a little. So we use HIPAA cleanse, and it's extremely important to stay clean during this procedure because we're putting in a permanent or a very long-lasting filler. And so I always ask my assistant to wipe with HIPAA cleanse before and you use sterile gauze. That's very important to use sterile gauze during this procedure. So it's kind of a tedious procedure, but you want to get it just right. And so if there's a little bit of bleeding, what I'll do is I'll move on to the other side. I'll have my assistant come on over here, and then we'll come back to that in a second. Again, I can see these scars a lot better with this headlight, and there's one right here we're going to fill. And you do a little bit of massage afterwards, and we ask the patients to massage it as well. We ask them to massage it for a few days, a couple times a day, maybe even more than that. You will begin to, so Bellafill is made up of collagen, bovine collagen, which is cow collagen, and that goes away in about 6 to 8 weeks, at most 3 months. And then the PMMA particles, clean that for me, those microspheres that create a matrix for collagen stimulation in the body, which gives you that long-term result. And there's studies that show 5 years worth of improvement, and it's FDA cleared for 5 years, but there's even studies going as much as 10 years showing improvements. So it's one of the most studied fillers in the world as far as long-term results and safety.